What's up, everybody, and welcome back to another edition of the Bulletproof Dental Practice Podcast. We got Pete and I today, which seems really nice. Because, you know, it's you and me with Galloway, and then me solo, and you solo, and got the old OG crew back. It's awesome.
The group is back together, buddy.
It feels so good. It's reunited, and it feels so good. I actually love this topic, Peter. I really, really do.
Well, you haven't told everyone what the topic is.
Well, it doesn't matter. Let's make it.
Hey, how do I sound, by the way?
Sound fine to me. Why?
Because last time you said something about my microphone, it messed with my head. You know, don't mess with the podcaster's microphone.
No, it bothered me during the Galloway thing.
I figured it out. It was pretty bad. So my apologies, Professor Galloway. Sorry, I blew it again with a celebrity guest.
Oh, there's absolutely no way he'll ever listen to that podcast.
Ever.
I love how he starts. He's like, how the fuck did I make it this low? I just was on BBC a minute ago and CNBC next. And now I'm with you, dude. You know, I loved it. It was so good, that intro.
All right. But that is not what we're talking about today.
It's not, but it was such a good podcast.
Hard left.
Because
I saw this actually, something from Donald Miller's podcast. I'm a big fan of his. I like to listen to what he has to say.
The story brand guy, right?
Yeah.
Donald Miller,
and it was one of his topics was dealing with an angry customer. And I said, you know, there is an art to diffuse it. So how do you deal with upset patients in your practice, right? Because there's two trajectories. And I'd like to unpack that because I've seen, it's definitely a science in that. So seeing our colleagues and how they do, you can bow up or you can kind of get strategic with that. So Craig, you're really good at reading people. And I've actually heard some of your dialogue with patients and, you know, and you've told me about stories about people who've been upset. So I'd like to hear that because I think it really is a science and let me give some context because I think this is important. As dentists, we throw our heart and soul into our treatment and everything. And we get emotionally hurt when a patient is upset, right? It's not just, hey, this thing is cold, or this product didn't perform. It's like,
you suck as a human being.
It's everything in our being. I can remember losing sleep, like to the point where, like, you know, being nauseous and having, you know, sicknesses because of having a patient being upset. Meanwhile, I did the best I freaking could, right? But I was still, it bothered me. So my point is I've loved some of the dialogue that I've heard you with some clients and how you deal with them. So why don't you go? Why don't you do?
Yeah. So there's two things I want to think we need to dive into. So there's the obvious of the upset patient, which we're all understanding, and how to deal with that. And then there's the upset patient who leaves a review. And I want to kind of break it down into two separate things because so let's go first. So let's go first with the upset patient. So we are all ethical, caring providers. We care about what we do. We treat our patients as if they were family. And all of a sudden this patient comes in and says, you try to rip me off and the thing you did broke and they're trying to sell me. And the problem is if you're dentists like Pete and I, and most of you I'm sure are, where you actually do what's right for patients and you really pour your heart and soul into it, when something goes wrong and they accuse you of doing something bad for them, it's a values attack. It's saying you are not a good person.
It's a character assassination.
It's a character assassination. We're not even talking about the review. We're going to put a pin in the review thing for a second. So you have hot, upset patient. And there's a saying, I don't remember where I got it from. So if that was Pete, that means I take it as my own, but I don't roll like that, Pete.
It's fine. He's like a Confucius. Go ahead.
Exactly. So it's all communications, either one of two things, a loving response or a cry for help. We all know how to recognize a loving response. Like, hey man, you rock. You're awesome. Thanks for helping me. That's easy. But we don't always know how to hear a cry for help. And a cry for help, especially after the sale. So imagine you buy Panasonic XYZ razor and you go home, you bought it off OfferUp, you go home, you plug that sucker and it just doesn't move. You're going to be super pissed because you're like, I got had. I just bought this and I have no recourse and blah, blah, blah. So you tend to bow up and get really mad at people when that happens. Same thing in dentistry. So you're all attentive to them, you put in a crown and they go home and the bite is high. And what do? Instead of calling you, they talk to their friend and their friend says, ooh, I went on WebMD and my uncle's brother's, nephew is a dentist and I think you're gonna need a root canal. And they get all bowed up. And by the time they get to you, they're like, you put this thing in, I can't chew. And every time I bite down, it's hurting now and nothing hurt before. All they need is a bite adjustment.
Yep.
but they're venting. So the first thing you do when you're dealing with someone, this is just, my takeaway, and everybody's got a unique perspective. So this is just what works for me. So I let people vent, fully vent. It's like, imagine a hot air balloon. It's like they're filled up with anger and air. And it's a cathartic process for people to completely go and vent it all out. You wait till they're all done.
I will say that I do so we are totally aligned. I think we're going to start differing, but we are totally aligned there. Sometimes all people want to do is they just want to get it off their chest, and they want to hear the sound of their voice articulating their madness, right? They want everyone to know. So yes, hot air balloon, let it go. Sit there and don't say a fucking thing. Yeah. Just let them go.
Did you just beep yourself, Pete, with the fucking thing?
I did. Wasn't that pretty good?
That was awesome. It's like almost like a beatboxing trip you did.
Yeah.
Okay. So anyway, yeah, I totally agree. And typically a couple things will happen. So they'll get it all out and they'll start to feel better, or they want to keep going and keep going and keep going, and let them go. Let them go. I had a guy the other day who was really mad about a provider he saw before me, and and then this happened, and then this happened, and this happened, and this happened. He finally let it all out. And I'm like, God, what was his name?
It doesn't matter. Bob.
I know, but it's just like I'm just mad at my brain right now. Carl. I'm like, Carl, you realize you're sitting now with me, right? Yeah, I know, but that guy. I'm like, well, you realize that he's not working on you anymore, right? It's me. And you realize how much, how dedicated I am, and how, even though things go wrong, I'm going to try my hardest to make it right. You realize that, right? Yeah. And he started going back again, and I just had to let him vent enough. And then finally he was, they're basically, you exhaust yourself. Mm-hmm. And then you say, you have to empathize, you have to hear, and you have to recognize what they have to say. So I understand why you'd be frustrated.
There you go.
Totally understand how that must seem like we don't care that we didn't call you back.
So that's an important thing to put a pin in, Craig, that you just did. This is the psychology of stuff, is that, as opposed to your verbiage is everything, right? And the way you communicate that is, we're on the same team. I understand, right? And sometimes people just want to be understood, as opposed to being confrontational at this stage of the game.
Well,
now
we did call you back. The bite's just high, man.
Right.
Like, it's just a high bite. Come on, man. No big deal.
Right.
Like, do you really want to fall on your sword?
Validate what they're feeling like. Don't call them a crazy. Yeah. Don't all this stuff. Just validate the way they're feeling, because perception is reality. It doesn't matter.
Right. And also, like, there's a great saying. It's probably from Boulden, because I probably stole it from him. But it's like, do you want to be happy, or do you want to be right?
Neither one of those were mine, by the way. But I will own them.
That's so do you want to be happy, or do you want to be correct? So at the end of the day, where you're coming from.
I think that's a marital thing, by the way. That's a marital quote. Do you want to be happy when you're fighting with your wife?
That's the next podcast. No, actually, my wife and I are doing okay at this particular moment in time.
I'm saying I think that's a marital advice. Like, do you
marital
guy? If you're a guy, marital. If you want to be, if you're a guy, do you want to be happy, or you want to be right? Like, just surrender and fall on the sword.
Anyway, I'm not good. I don't know. I totally disagree with that, by the way. All right. Can we make another podcast, like our tips for marriage and polarity?
No,
and all that
because
stuff?
neither one of us have the chops.
Well, dude, we're married. Combined experience, 40 years of dentistry, combined 35 years of marriage, brother. All right, I digress.
Quantity does not.
Okay, so validate their concerns. Don't bow up and say, hey, Carl, high bites happen and it's not a big deal and I can fix it. Because to them, then you have to listen to another 2-minute deflation of their anger. Right. They just deflated. I can totally understand how that could be incredibly frustrating. I know what it's like not knowing why it hurts. It's actually really simple why it's hurting, and I'm going to be able to fix it in just a moment. But it took me 2 days to get in here and blah, blah, blah. I'm really sorry. That must be really frustrating too. I mean, it's a 5-second thing, but it took you 2 minutes to get here because I was doing podcasts with Peter all day. That must be really, a difficult thing. And I'm sorry about that. So validate their concerns, validate it, and then make a pledge to take care of it, and in the face of confrontation, always state what you stand for, what your mission is. You can have an opportunity like, listen, I take this stuff really seriously. It's my mission, my goal, my purpose to make sure patients are happy with their dentistry. And you're no different. That's my mission. That's what I do. So reaffirming your commitment, or my commitment, is to always make sure patients have their best care, feel their best. And that's what we're going to do for you today. And then you can also say things like, what is it that you need right now in order for this to be right?
So this is what I always tell people: let them go. I tell my team this: let them go, right? And then you have to, at the end, say, what do we need to do to make this right? right? And sometimes we're so afraid to ask that question for the fear of the response, because we've already said like, holy shit, they're going to ask for 200% of their money
No,
back,
they
right?
never asked for
Let me
that.
give you a scenario, Craig. This happened circa 2006, probably
So the
7.
last time you were in the office, or
Shut save it. You can't say that.
I
That's
love
bullshit. I've
saying that
worked my
though.
freaking
I know,
face
I know.
off.
I'm kidding. I love
I
you,
wish I
Pete.
could
It's all
reach through
good.
and
Go.
grab your mini torso and
My
pull
mini
it through the
torso and
screen.
choke me.
Um,
I have a joke, by the way.
all right. So this and this. So I'm doing number 18, guys squirming around all over the place. I'm trying to do, because he was feeling it, bulk reduction, trying to get through it fast. No one likes working on number 18. Have a big round football, black diamond burr. Okay. He moves and says, ow, goes through his tongue. Like when I say to his tongue, he almost bled out in my chair.
Never done that before.
Dude, it was horrible.
Oh man.
But like nothing I could do about it, right? Burr's spinning at 1,000,000 miles an hour, and then he jumps up and
curl up. And
it was to the point where he had to get stitches, go see a specialist, blah, blah,
Oh,
blah, blah,
shit.
blah. Right. So now I'm thinking, great, career's over. I'm gonna get sued. This is it.
Yeah.
So ultimately, he and I finally have a conversation, and of course I call patients every night. I've done that since the dawn of how I had a license. And I think that has circumvented so many issues, certain problems upset. Just call every patient you give an injection to. That's marketing 101. But let me go back to this guy.
The single greatest
Easiest
trick of all things. It's not even it's the easiest. It's the single greatest result you can get.
So anyway, 2 weeks go I can't sleep, can't eat. I know like this guy's going to sue the shit out of me. Like, I'm going to lose my license. Family's going to have to live in a box, all the things, all the horrible things. And finally I got to talk to him. We're talking, he's man, all this pain you caused me. And I've been sitting, can't do anything for 2 weeks and blah, 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 blah. And so I said, you know what? I'm not going to blow up and get defensive, even though I'm a young baby dentist. I'm just going to hear him out. And I said, I'll tell you what do I need to do? What can I do at this point to make it right with you? And he said, just all this pain and suffering and blah, blah, blah. And I just, I hate you. Right.
Wow.
And it's like, okay, what do I need? What do we need to do? And he's like, well, I don't. And it was a gold. I'll never forget. It was a gold onlay. Right. He said, well, you know what? I'll tell you what can make it good. I want my money back for this procedure. So, okay. Would that make it right? He said, yeah. And in my head, I'm thinking, it's a $185 lab bill. My time. I was like, done. No problem. You know what? You deserve it. I'm sorry this happened. Couldn't avoid it. All the things. But you know what? You're right. If this makes it better, it's on you. I mean, it's on the house rather. And guess what? That was it.
And by the way, the greatest part about it is if they really, when anybody's going off on you, remember that the best thing you can do, revenge, and I use the word revenge, but it's really payback, is served best cold. So when people are going off and losing on you and you let them vent and then you react calmly back to them, they have guilt. They feel bad. So whenever someone's really upset, I had a guy once come in, he was complaining about his wife's teeth and blah, blah, blah. He left. He actually signed up for Invisalign himself and paid for it.
Oh my God.
And it was just like, hey man, he came in really hot and he heard me and my commitment to do it right and whatever it took. And he felt so bad.
But I think so many of our colleagues, and I've been guilty of this, you want to just duck and hide. If there's an angry patient, like screw them, don't let them get to me. And you tell your front business team, like they're crazy. Don't let them, don't pass the phone to me. Or don't give them my email. Right. And you avoid this. And really by the time the patient can never be heard. And so sometimes the only way they can be heard is by calling Georgia board or the Florida board and telling them the story. Right. But it could have been circumvented by you just having a conversation. Maybe sometimes not.
And that,
right?
By the way, that conversation, the biggest kickoff to that conversation, and to come full circle on it, is that post-operative call.
Is the post-operative
call, even if it's super quick, like, yeah, everything's fine. Good. See ya. No, the bite is a little high. Oh, that's really easy. You get them before they go to WebMD, before they call their sister's brother, or, their husband's uncle or whoever that's a dentist, and they start spinning up. Because what happens is the mind works in a series of decisions. Like, it shouldn't be high. I went in there, it wasn't hurting. They don't know it's high. Why is it hurting? Every time I close now, it's really disconcerting. And they need answers. And we're living in an information age, so they'll spin up out of control. But I think it's really important that you
let me also talk about this, and then we'll put a button in it, or a cap in this. what am I trying to say? We'll end this. Is that you talked about reviews, right? And so use reviews. Sometimes people get online and bash you, and you can use that as an opportunity to explain that, yes, you were right in the experience that happened. Like, just own it and step in front of it. There's a book called Extreme Accountability that goes over this. Just own it and say, you know what, we did the best we could at the time we could, blah, blah, blah. And maybe, and in our practice, and then use it as an experience, use it as an excuse to say, these are the way we do things in our practice. And maybe you didn't see the value in it, but you spin it as a way to say, maybe you're just not the right fit for the practice without saying that.
I want to add to that. So remember, when you're
you can use it to market, is my point.
Yeah,
but,
I know.
But address the negative. Address the negative. Don't hide behind your reviews or a mad patient in person.
Okay, so here's what I want to say about the review. So remember, you are not writing the response. First of all, you should respond to every review, positive or negative. Always
100%.
respond. So, oh my God, I love Lacey. Yeah, Lacey's fantastic. She's been with us for 3 years. Thank you so much for recognizing Lacey. You guys suck. You ran late. So the most important thing, I've learned these couple things. Don't respond immediately on a negative review because they're hot and they want to vent. Just wait. There's a cooling off period. This is just my personal advice. Wait 2 or 3 days. And then remember, you are responding to this review, not for the angry patient, but for the thousands of people that read your review. Okay.
This is why I let you come on my podcast, Craig.
Thank you so much. Yeah. I really appreciate that. That's so kind of you. So we're
so aligned.
Yeah. So you are responding for that, not for the patient. So you guys suck. You ran late. Signed, angry patient. Dear angry patient, we strive to run on time in the practice. However, nothing runs to perfection, and sometimes the needs of emergency patients or schedule interferences can come up. We truly apologize for missing the mark. Clearly, we missed the mark with you. Clearly, we did.
It. Love it.
We owned it.
You didn't hide from it.
We truly apologize. That's not what we stand for. We absolutely. You're right. We fucked up today.
Give us one more chance, kind of thing.
Yeah. No, but we understand. Please contact the office to discuss the intricate details of your case or your situation so that we may have the opportunity to earn your trust and business once again.
Mic drop. And the beauty of that is, Craig, you said it brilliantly. You're not writing to that person. You're writing to the thousands of people in the audience. And you'll get
people, by the way, and I've had this happen before. I saw you at a negative review, and I love how you owned it. And that's why I'm here. So then, because remember, people like HIPAA, oh, we can't find your name in our practice. Because like sometimes people just want to spam you and be like, you suck. And sorry, dear Pam, we don't have anybody named you. It's just like, hey Pam, clearly we missed the mark. We strive to be, giving the best care and building long-term relationships. We're so sorry we missed that for you. Please email Nikki at Spodak, to discuss the intricacies of your case so we may have the opportunity to earn your trust and business once again. Signed sincerely, blah, blah, blah.
Love it.
By the way, when they email you, you can be like, say whatever the hell you want.
Exactly.
Because if they come back on now, the best thing the patient can do is go crazy. No, I am not going to call. And I don't even want a chance to talk to you again. You guys are a bunch of crooks. And then leave it alone. You showed crazy. Once you show crazy, you lose your point. And that comes full circle again to letting people vent. If they go and vent and say things that are really unacceptable, like not only this, but like I had a lady once go off on me for the charity we do.
I know you've told that story.
On the podcast?
Yeah, I think so.
No, I haven't. So let me just quickly.
Times.
Okay. So just put the picture of yourself like you're on
Frozen.
the podcast. Yeah. Freeze yourself. So anyway, I had a lady was getting a pano at my office and she's like, I have to talk. I have a bone to pick with you. I'm like, oh, what's up? She's like, we need to talk in private. So I'm like, okay, come over here. She's like, I see you do all this charity for people. I spent blah, blah, blah money on my teeth and you took my money and gave it to somebody else. You know how hard my life has been? I'm like, oh, I think you misunderstood. You paid the office for your dental work and I took that money and spent it on someone else. That wasn't your money. It's like saying like you bought your car and then Ford decided to take your money and do something good with it. No, that was my money. I just didn't decide to buy a boat. I decided to help other people out with it. Well, you ought to be ashamed of yourself and blah, 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 blah. And I just let her vent and let her really just go off. I'm like, so if I understand you correctly, you're actually mad that I do charity. Is that correct? Well, yeah, you're not doing it for me. You're doing it for these kids and all these other people. I'm like, well, then you and I have we have an alignment issue. because my values say that once you pay for something, you've transacted and that money is no longer yours. And my value is that a business like ours has a responsibility to give back to the community. You need to go somewhere else, because you need to find someone that has better values with you. There's other dental offices. There's nothing to hold you here. So why don't you do us both a favor and find alternate care, and I'll email you your x-rays, and listen, I'll love you right at the door. I want you to be happy though. And you're not happy here. And that's a good way to identify mismatches, because some people will want to stay in their dirty
That should
diaper.
be a whole podcast on itself. Like when to know when there's a mismatch, when people disrespect your practice, disrespect you, don't value
disrespect
what you're
your
doing.
team.
That's what I said, team. Did I say that?
No, disrespect your practice, disrespect you. But you walk in, by the way, they've been rude to your front desk receptionist. They've been rude to the hygienist. You walk in like, oh my God, Dr. Bolden. So nice to see you. And like, who was this banshee a minute ago?
It's not patient first. It should be team first, you know.
It always is, brother. Yeah, I know a very famous person once said that. You know who said that?
Who?
Dr. Craig Spodak.
Oh, look at that guy. He's like the Confucius of dentistry. You're the new Confucius. I was the old.
Yeah, it's all good, bro.
Hey, I've had enough of you today. I've
had enough of you. No. Let me do that. Hey, Peter, it was really fun, but I've had enough of you. Remember when sometimes Peter and I are on the phone and he's like, I got to go. I'm like, no. Let me just tell him one thing. And I would say, I'd hang up on him.
Just hang up.
We'd actually he's trying to get off the phone quick. I'm like, no, Pete, before you go, wait.
I got one more thing to say. Blick. What a jerk.
All right, guys, thanks for listening. And if you like what we're saying and doing, please drop a like or a comment. We're here to help more people. And all this content is free. Come on, let's share it.
And crush that negative review, because there's negative reviews, right? So, or whatever, that one that crushed my heart. Just you guys have been awesome with the reviews, by the way, of just blasting and getting the word out. And if you got a friend who would benefit from hearing what we do, look, share the love. Send this podcast out, or send one of them out, or send your favorite to a friend that may value or get some value from what we're saying. And that's it. Over and out, everybody.
Thanks, Petey.
Okay. Bye.
Later.